Hi, welcome to my podcast. This is Dr. Jaime Daniel, and today I want to share with you an overview of sports injuries. This term refers to the kind of injuries that most commonly occur during sports or exercise, but they are not limited to athletes. Factory workers, for example, get tennis elbow, painters get shoulder injuries, and gardeners develop tendinitis. Even though they may not participate in sports, ultimately, however, sports injuries refers to those that occur in active individuals. Today we will focus on the most common types of sports injuries, those that affect the musculoskeletal system. The musculoskeletal system is the network of muscles, tendons, ligaments, bones, and other tissues that provides the body with stability and enables movement. Sports injuries are divided into two broad categories: acute and chronic injuries. Acute injuries happen suddenly, such as when a person falls, receives an elbow, or twists a joint, while chronic injuries usually result from overuse of one area of the body and develop gradually over time. Examples of acute injuries are sprains and dislocations, while some common chronic injuries are shin splints and stress fractures. Treatment for sports injury depends on the type of injury, but minor wounds can usually be treated at home by resting, icing, compressing, and elevating the injured part of the body. For more serious injuries, you will need to see a health care provider, and you may need to be set up for a course of physical therapy, for rehabilitation, and fitted for a cast, splint, or brace. In some cases, you may need surgery. A rehabilitation program that includes exercise and other type of therapy is usually recommended before resuming the sports or activity that caused the injury. While adverse events do sometimes happen when playing sports or exercising, most physical activity is safe for almost everyone, and the health benefits far outweigh the risks. Anyone can suffer a sports injury, but several factors can increase the risk of sustaining injury. The risk factors for sports injuries include things like not using the correct exercise techniques, overtraining, either by training too often, too frequently, or for too long, changing the intensity of physical activity too quickly, playing the same sport year-round, running or jumping on hard surfaces, wearing shoes that do not have enough support, not wearing the proper equipment, having had a prior injury, having certain anatomical features specific to each joint or poor flexibility, taking certain medications such as fluoroquinolones, a class of antibiotics linked to the tendinitis and tendon ruptures. The type of injury you are most vulnerable to depends on the type of activity you participate in, your age, and your sex. Sports injuries are broadly categorized into two kinds: acute injuries, which happen suddenly, chronic injuries, which are usually related to overuse and develop gradually over time. In some cases, Wear and tear from overuse injuries can set the stage for acute injuries. Injuries to the musculoskeletal system that are common in athletes include fractures, dislocations, sprains, strains, tendinitis, or bursitis. We will define some of them. A bone fracture is a break in a bone that occurs from either a quick one-time injury known as an acute fracture or from repeated stress known as a stress fracture. Growth plate fractures are unique to children who are still growing. A fall, a car accident, a blow can cause a fracture, and the severity depends on the force that caused a break. The bone may crack, break all the way through, or shatter. Injuries that break through the skin to the bones, which are known as compound fractures, are especially serious because there is an increased risk of infection. Most acute fractures are emergencies. Stress fractures occur largely in the weight-bearing bones of the lower extremity. These include femur, tibia and fibula, and foot bones. They are common in sports where there is repetitive impact, primarily running or jumping sports such as gymnastics, tennis, basketball, or track and field. Running creates forces 2 or 3 times a person's body weight on the lower limbs. The growth plate is an area of cartilage near the ends of long bones, and they enable the bones to lengthen until children reach their full height. Growth plates are especially vulnerable to injury until they are converted to bone. Typically, by the time a child reaches the age of 20, growth plate fractures can result from a single traumatic event, such as a fall or car accident, or from chronic stress and overuse. When the two bones that come together to form a joint become separated, the joint is described as dislocated. Contact sports such as football and basketball, as well as high-impact sports and sports that involve significant stretching or falling, cause most dislocations. A dislocated joint typically requires immediate medical treatment, but sometimes the bones move back into place on their own. A dislocation is a painful injury and is most common in shoulders, elbows, fingers, kneecaps, and femur, tibia, or knee. Sprains are stretches or tears of ligaments, the bands of connective tissue that join the end of one bone with another. Sprains are caused by trauma such as a fall or blow that knows a joint out of position. Sprains can range from first degree to third degree. Areas of the body most vulnerable to sprains are ankles, knees, and wrists. A strain is a twist, pull, or tear of a muscle or tendon, a cord of tissue connecting muscle to the bone. Athletes who play contact sports can get strains, but they can also happen from repeating the same motion again and again, as in tennis or golf. Like sprains, strains can range from a minor stretch to a partial or complete tear of a muscle or tendon. This is most common in muscles or tendons between two joints. Tendinitis is an inflammation of a tendon, a flexible band of fibrous tissue that connects muscles to bones. It often affects the shoulder, elbows, wrist, hip, knee, or ankle. Tendinitis can be caused by a sudden injury, but it usually results from carrying out the same motion over and over. People such as carpenters, gardeners, musicians, and certain types of athletes such as golfers and tennis players have a higher risk of tendinitis. Tendons become less flexible as you age, so you are more likely to get tendinitis as you get older. Bursitis is an inflammation of the bursae, a small fluid-filled sacs that act as a cushion between a bone and other moving parts, such as muscles, tendons, or skin. Bursitis can be caused by a one-time event like a blow or fall. It can also result from repeating the same motion many times, like throwing a ball, or from prolonged pressure, such as from kneeling on a hard surface or leaning on the elbows. It usually affects the shoulders, elbows, hip, or knees. Most sports injuries involve one or more of the types of musculoskeletal injuries described previously. The joints are particularly susceptible because a person's body places significant demands on them. Joints must provide both stability and flexibility, and they are complex structures that include several interconnected parts. Some of the common injuries experienced by athletes and people who have jobs or hobbies that involve doing a repetitive motion can include things like shoulder injuries. And talking about shoulders injuries, we can mention three of them. Rotary cuff injury. These are the most common shoulder injuries. The rotator cuff is a group of four muscles and tendons that stabilize the shoulder joint. Rotator cuff injuries happen when the tendons or bursa near the joint become inflamed from overuse or a sudden injury. They are common in people with jobs that involve overhead motions, like painters or athletes who repeatedly reach upwards, such as tennis players and swingers. Impingement happens when the top of the shoulder blade puts pressure on the soft tissues beneath it when the arm is lifted. Tendinitis and bursitis can develop, limiting movement and causing pain. Repeated overhead movements, such as those used by swimmers, increase the risk of impingement. Instability. Shoulder instability happens when the round end of the upper arm bone is forced out of its shallow socket, either partially or completely. Once the tendons, ligaments, and muscles of the shoulders become stretched or torn, the shoulder becomes loose, and dislocations can occur repeatedly.